and the screen is clear. If the voice and screen are clear, just write in the chat. Is everything clear, guys? Can you hear me and see me? Can you hear me and see the screen? Okay. So last time we talked about the reversible cell injury, and we said that the differentiation between reversible and irreversible cell injury, the points of no return if the damage happens in cell membrane, mitochondria, or nucleus. If the damage happens in one of these three composition, so the damage and the injury will be irreversible. And we said last time that in reversible cell injury, we have two features: hydropic degeneration and helinosis degeneration. Anhydropic, when the cell lost the ability to get rid of the water, when the cell start to accumulate a lot of water inside the cell. And helinosis, when the cell lost the ability to get rid of the protein, and the protein start to be accumulated and condensated inside the cell. And we explained the whole hydropic degeneration, the cause, the definition, the site, the microscopic feature, the electromicroscopic feature, and the fate. Of course, the fate, if we remove the cause, the cell will return back to the normal. Oh, there's someone who wants to get inside the meeting. Okay. Mm-hmm. And we talked about helinosis, and we said when the cell start to accumulate protein inside the cell, it's called hyalinosis. Hyalinosis. And we see that hyalinosis, it's a microscopic change. It means that we cannot see it by our eyes. We just see it by microscope. It means that the protein start to be accumulated. The protein start to be accumulated, and we know that protein, it's eosinophilic. Eosinophilic means red color under microscope. So the cell, the helinosis will be like that, red or pink in color. And it's a very important MCQ. And we said that, of course, that when protein start to accumulate it will be homogeneous. Homogeneous means structure less. There's no clear structure. Why? Because this is the cell nucleus, and here it's a protein. It's the normal structure. But when the proteins start to be accumulated together, when the protein start to be accumulated together, so now it's not normal structure. So it means homogeneous. It means structureless. There is no normal structure anymore. And we see that hyalinosis, we have two types of hyalinosis: extracellular and intracellular. Extra means outside the cell, and intra means inside the cell. And we talked about the intracellular hyalinosis when the protein start to be accumulated inside the cell. And we said we have 4P. First P, it's plasma cells. And we know that plasma cells normally synthesize immunoglobulins. Immunoglobulins, they are protein in structure. But when plasma cell uh, fail to release these immunoglobulin, the immunoglobulin will start to accumulate and build up inside the plasma cells. And under microscope, we will see red deposition of protein. It's called Russell body. Russell body accumulation of immunoglobulin inside the plasma cells. It's a very important MCQ in USMLE. Russell body, it's accumulation of immunoglobulin inside the plasma cells when plasma cell fail to release these proteins. The second P, it's parenchyma of liver. And we say that the liver is the most common organ which can be affected by alcoholism. So when alcoholism affect the liver tissue, the hepatic cell, so the hepatic cell fail to release the proteins which inside it. And the protein will start to build up and accumulate inside the hepatic cells, and it's called Mallory body. And you see that they are, I'm writing in red color because protein, it's eosinophilic under microscope. Eosinophilic means red color under microscope. The third P, we talk about the proximal convoluted tubules. The proximal convoluted tubules, normally they don't reabsorb protein because by protein in normally protein does not pass through these tubules. But when glomeruli fail to reabsorb, to filtrate this protein, the protein will go inside the tubules, and the proximal convoluted tubules will try to solve the problem by reabsorbing the protein. But the problem that proximal convoluted tubules will reabsorb protein but will not be able to release this protein inside the bloodstream. So the protein will be accumulated inside proximal convoluted tubules, and it's called hyaline bodies. The fourth and last P, it's pneumonia or diphtheria, and they are bacterial infection, and these bacteria release toxins inside the blood. And we know that the most uh, important organ inside your body which need blood, it's skeletal system, skeletal muscles, because you move your skeletal muscle too much. So the blood with toxins will go to the skeletal muscle, and these toxins start to destroy some protein inside the skeletal muscle, and this destroyed protein will accumulate together inside the cells of skeletal muscle and form Zenker's degeneration. And all of these names, they are MCQ and international tasks like USMLE. Russell for plasma cells, Mallory body for parenchyma of liver cells, Hyaline bodies in proximal convoluted tubules, Zenker's bodies in pneumonia or diphtheria, in toxemia, in pneumonia or diphtheria. And the last example of reversible, of course, all of these, they are reversible. They are reversible. This is intracellular hyalinosis, but we didn't talk about the extracellular hyalinosis. Extracellular means that the proteins will be accumulated, but outside the cells, not inside the cell. Where outside? Outside, I mean in in blood vessels and inside the tissue, in the epithelial tissue. Let's talk about the examples. Examples, they are CAPS. CAPS. C for chronic glomerulonephritis, A for arteriosclerosis, P for prostate, S for scar. Chronic nephritis means inflammation of glomerulus in the nephron, in the kidney. And we know that if you get inflammation, the immune cells will start and will try to eliminate there's an inflammation. So when you get inflammation in glomerulus of the kidney, the blood will flow strongly to the kidney. Why? Because in this blood we have a lot of immune cells. So we need these immune cells to go to the place or the site of inflammation. So clinically, clinically, your patient, when your patient has glomerulonephritis, he will get hypertension, increase in blood pressure, and the blood will come too strongly to the glomerulus and the capillaries of glomerulus, and this strong and this increased blood pressure will damage the wall of small capillary inside the glomeruli. The blood will come so fast and start to destroy the walls of the capillary, because the capillary inside the glomerulus, they are very very narrow and small in size. And we, of course, in the wall of the capillary contain proteins. So these proteins will be damaged and accumulate inside the capillary of glomeruli. And when they accumulate, it's called what? Hairinosis. So hairinosis of glomeruli and the capillary of glomeruli. So in glomerulonephritis, your patient has hypertension. The blood will come so fast to the kidney, so fast to the blood capillary inside the glomerulus. And we know that the capillary, they are very, very small. They are very small in size. And when blood comes so fast, so the blood will start to rupture and damage the capillary wall, and the capillary wall contain proteins, and this protein will be accumulated inside the blood capillary. And we know that accumulation of protein, it's called hairinosis. But this is extracellular, it's not inside the cell, it's inside the blood capillary. The second example is the same like the first one: arteriosclerosis. In benign hypertension. In benign hypertension, we know that hypertension cause damage of the blood vessel walls, and blood vessel walls will get sclerosis, means destruction of the blood vessel walls. And we, of course, the protein will be accumulated inside the blood vessel and causes hairinosis of blood vessels. The third example is prostate. And we know that the most and the commonest disease in prostate is prostatic hyperplasia. Prostatic hyperplasia. And we talked about that before, that prostatic hyperplasia mostly occur in old age persons, old age males. And we know that in old age males, they don't produce a lot of androgen. They don't produce a lot of sex hormones. So the normal function of prostate to produce proteins, and these proteins are consumed by sperm and are consumed, and this protein inside the prostate, this protein which prostate synthesize, they are used to for sperm nutrition, and they are used in formation of androgen. The protein inside the prostate, they are used in formation of androgen. But the old age man, he doesn't have a lot of androgen. He doesn't form a lot of androgen hormones. So the protein inside the prostate will be accumulated because they are not used anymore. So when proteins are accumulated inside the prostate, so the prostate will be increased in size, and this protein will cause hairinosis inside the prostate. The last example is scar. And scar, this is the skin tissue, and here we have collagen, and here we have collagen. And we know in scar, if you have wound, the collagen will start to regenerate normally and then form normal tissue. But the problem in scar that under the collagen there's fiber, a lot of fibers in your skin. And so this fiber start to reduce the fibroblast. When you get wound, the fibroblast will come and try to form a lot of fibrin protein. It's called fibrin protein. So a lot of fibrin will be accumulated here, and they will be accumulated together and form abnormal surface. It's called scar. It can be permanent scar. So this accumulation of fibrin, it's called hyalinosis because it's accumulation of some protein. So extracellular, extracellular, they are caps C4. Chronic glomerulonephritis A, for arteriosclerosis P, P for prostate, prostatic hyperplasia S for scar, and intercellular hyalinosis for P. First P is plasma cells, Russell body, parenchyma of liver or hepatic cells, Mallory body, proximal convoluted tubules, hyaline body, pneumonia or diphtheria, Zenker's degeneration. The last example of reversible cell injury, it's mucin degeneration, accumulation of mucin. And we know that mucin, it's a protein which is produced and synthesized by epithelial tissue, not connective tissue. It's produced by epithelial cells. So the tissue which contain mucin is epithelial tissue, not connective tissue. So in some cases, we can see accumulation of mucin in epithelial cells. So we call it mucoid chain. It's a when mucin is accumulated in its normal site, which is epithelial tissue. So we call it mucoid change. But the problem that we have weird situation when we see accumulation of mucin inside abnormal site like connective tissue. Oh shit. Can you imagine that you will see mucin in connective tissue? You will see mucin, for example, inside the skin or in the bone. So it's abnormal sites because we know that mucin, it's found in epithelial tissue. So when mucin is found in connective tissue, we call it myxoid chain. So mucoid accumulation of mucin in its normal sites, which is epithelial tissues. Myxoid chains accumulation of mucin in abnormal sites like connective tissue. Let's talk about mucoid change, which is accumulation of mucinous material in epithelial cells. Three examples. First one is catarrhal inflammation. Catarrhal means inflammation in mucous tissue, like your nose or oral cavity, which can contain mucus. So we call it catarrhal inflammation. When you have rhinitis inflammation of nasal sinuses, you start to get runny nose. There's a charge from your nose. Why? Because the mucus cells inside the nose start to accumulate a lot of mucin, and these vacuoles which are filled with mucin will be ruptured, and mucin will be released, and you will get runny nose, a lot of discharge from your nose. Why? Because when you will get inflammation, the immune cells will go to the mucus cells and start to fight the infection, and the mucus cell will be hyperactivated, secreting a lot of mucin to protect your tissue, epithelial tissue, because the epithelial tissue, when it will get inflamed, it will try to protect itself by secretion a lot of mucin. And mucin will be accumulated inside epithelial cells, and the epithelial cells, when will be filled with a lot of mucin, will be ruptured, and then you will get a runny nose. The second one is mucoid carcinoma. Mucoid carcinoma means cancer of the epithelial cells. When the cell will get cancer, the cell, of course, will be mad, crazy. So uh, the cell will start to secrete a lot and a lot of mucin protein, because it's not under our control. So the cell will be accumulated with a lot of mucin, and we call it mucoid carcinoma. Under microscope, you will see the mucoid cell, the epithelial cells converted into mucoid cells. It means that the epithelial cell now are very accumulated with a lot of mucin, and we call it mucoid carcinoma. And we will explain the types of carcinoma in systemic pathology. The last example of mucoid change is mucocele. Mucocele. Anyone know what does it mean, mucocele? What does it mean, mucocele? Anyone knows? Or just try, even if it's a mistake, it's not a problem. Okay, let me explain it. Mucocele, a lesion. It's like a lesion which happens in salivary glands, or which happen in your mucus gland, the gland in your oral cavity which secrete mucus. So this is the structure of salivary glands, and here the normal structure. But sometimes you get maybe accident, or someone hit you in your face and cause rupture of the normal structure of salivary gland. And we know that most of salivary gland, they secrete mucus. Then the mucus will go outside. The mucus will go outside. So the mucus will was inside, but when the rupture of normal structure, the mucus will go outside. So it's called, this type of mucocele, it's called extravasation cyst. Cyst means, we said before that cyst means accumulation of water under the tissue. So here the water will go under the connective tissue inside your oral cavity, because the water escape from the mucus gland. So it form a cyst. It means extra means outside the mucus gland. And the main cause, it's trauma, which cause rupture of normal structure of salivary gland. Then the mucus will go outside. It's called escape of the mucus, escape phenomena. So it's called extra means outside, extravasation cyst, formation of cyst, but outside the mucus gland. And the second type, when the mucus trapped inside the mucus gland. Why? Maybe because it's secondary to some obstruction inside the salivary gland. In the duct here, so there's some obstruction, then the mucus will be accumulated inside the mucus gland. So accumulation of saliva will form swelling of the mucus gland, and this type it's called mucus retention cyst. Mucus retention cyst. So the first one, when the mucus escape outside, it's called extravasation cyst, and it's caused, the main cause is trauma. The second one, when some obstruction can obstruct and block the duct, and the mucus will be accumulated inside the mucus gland, and it's called mucus retention cyst. Mucus retention cyst. And of course, extravasation cyst, it's the most common, because a lot of us, maybe you in accident or maybe in some fight, you can get some trauma to your face and cause damage of the mucus gland tissue. So these are three C. C, cataract inflammation, inflammation of mucus cells, mucoid carcinoma, C, mucocele, and myxoid change, when the mucus start to be accumulated inside the connective tissue, which is abnormal site, because normally we don't have mucin in connective tissue. So it's called myxoid change. But what are the causes of senses and accumulation of mucin inside the connective tissue? First one is tumors. Some mutation happen, in connective tissue cells, and then the cells start to form mucus, and it's called myxoid change in tumors of connective tissue. When you find mucin in connective tissue, it's abnormal, because normally we don't have mucin in connective tissue. So you can admit that there's a tumor inside your connective tissue, and then some mutation in this tumor lead to accumulation of mucin. The cell now start to synthesize mucin, and it's called myxoid, not mucoid. Mucoid means when the mucin abnormal inside in normal location, which is epithelial. But myxoid, it's abnormal senses of mucin in abnormal location. Now we will talk about irreversible cell injury, and the first one is necrosis. Necrosis, and it's a very tough and it's a very cruel feature of irreversible cell injury. Normally, we don't get necrosis in just one cell. Necrosis always occur in group of cells. Anyone know why necrosis occurs in group of cells, not just in one cell? I will open the mic. Why necrosis occur in group of cells? Anyone is gonna share? Hello, guys. Guys, just share with me. Share your idea with me. If it's wrong or if it's correct, it doesn't matter. No problem. Just share with me. So again, the question: why necrosis always occur in group of cells, not just one cell? Serene, you were sharing with me too much in last lectures, and Aisha as well. Okay, let me explain why necrosis occurs in group of cells, not just one cell. First of all, what does it mean irreversible cell injury? It means destruction of cell membrane, destruction of mitochondria, destruction of nucleus. Okay, what's gonna happen if mitochondria is destroyed? We said before that inside mitochondria we have something called free radicals. Inside the cell we have something called lysosome. They are proteolytic enzymes. They are enzymes which can break down the protein, and the free radicals can break down and destroy all structures. So when the cell is destroyed and cell membrane destroyed, all the free radicals inside this cell will go to the next cell, then destroy the neighboring cell, and then we'll go to the third and fourth, fifth, as so the free radicals will move to the all neighboring cells. The lysosome will go to the all neighboring cells and start to destruct a group of cells, not just one group, until the body start to trying to stop this process. But until the body stop this process, the free radicals from one cell move to the next cell to the next cell, and so on. That's why it's not logic to say that necrosis occurs in just one cell. No, because the free radicals will move to a lot of neighboring cells and cause death of group of cells. So necrosis is death of group of cells inside living tissue directly or following degeneration. Necrosis is surrounding by inflammation. Why? Because of course immune cells, because we have a lot of immune cells, and we will study in detail the role and function of each immune cell in immunology. That when we have any stimulus or any death or necrosis in some cells, the free radicals will start to move out and cause inflammation of the neighboring cells, and then the immune cells will try to stop this process. So the T lymphocyte, the macrophage, will go to the site of necrosis and start to produce some mediators, inflammatory mediators, to kill this group of cells. So of course the necrosis will be surrounded by inflammation due to the effect of immune system and immune cells. Okay, in pathological picture, when you look in the pathological cells, in this dead cell, what are you gonna see? Of course, eosinophilia. Eosinophilia means red color. Why red color? Because of two things. First of all, because inside the the dead organelles a lot of proteins. So these protein, they are free, and this protein, they are denaturated, means broken down. So a lot of protein metabolites will be destructed and will be accumulated inside the dead cell, and we said that the proteins are red in color, eosinophilic in color. And in histology, you study that the RNA is blue in color. RNA gives the cell a little bit bluish color. And of course, the free radicals will destroy and kill the RNA. So we don't have RNA anymore, so we don't have any blue color inside the cell. So eosinophilia, because of something which lead to red colorish of the cell, which is proteins, because the protein, of course, will be free from mitochondria and some organelles, and will be accumulating inside the cell, and the cell will be will appear in red color, and the RNA will be destroyed, and we know that RNA was responsible for bluish color of the cell. Now, unfortunately, we don't have RNA, so we don't have blue color. So the necrotic cell under the microscope will be eosinophilic. And of course, nucleus will be destroyed. What feature of destructed nucleus? We talked about that in last lecture. We said pyknosis, karyorrhexis, karyolysis. Please go back to the before last lecture and and see the differentiation between pyknosis, karyorrhexis, and karyolysis. But all of them means destruction of nucleus. So of course, the nucleotic cell is red in color and nucleus is destroyed. We have five types of necrosis: coagulative necrosis, caseation necrosis, liquefactive necrosis, fat necrosis, and the last one we don't consider like necrosis, but and I will tell you why it's not considered necrosis. It's called fibrinoid necrosis. So four main type of necrosis, and the last one, the fifth one, we don't consider it like necrosis. So in each type, we have to know three things: the cause of this necrosis, the shape, and example. The cause, the shape, and example. First one, coagulative necrosis, and it's the most common one. The cause is hypoxia. Hypoxia, which happen because of ischemia. When blood supply is blocked to the organ, then there is no oxygen or blood is going to the organ, and then the the cells in this organ start to die. They start to die off because we know we talked in the first lecture, in the second lecture, that when we don't have oxygen, hypoxia, ATP will not work, then sodium potassium pump will not work, sodium will be trapped inside the cell, sodium will trap a lot of water, and the cell will start to be swelling. And after that, if we don't remove the cause, the cell will start to die because the water will destroy the mitochondria, the nucleus, the cell membrane, and it will be irreversible cell injury. So here, the hypoxia is the main cause, which happened due to ischemia. For example, this is the kidney, and here the renal artery, and here's some block which obstruct the renal artery. So there is no blood and oxygen is going to the tissue. So the cells start to die. Okay, what the color of cell of this cell of necrotic cells will be? Anyone knows the color of the cell of necrotic cells? I open the mic. What is the color of the necrotic cells, guys? Aisha? No, of course. Listen, when you boil some fresh meat, the fresh meat it's red in color, but when you put it inside hot water, so the color will be red or pale. Of course it will be pale. It will be pale. So here in coagulative necrosis, the cause is hypoxia, and the shape of the cell, the color is pale. The color is pale because there is no enough blood supply is going. How it's gonna be red? Red if a lot of blood supply is going to the organ, but Here we don't have enough blood supply because the blood supply is blocked. So of course it's never be red. It will be pale in color. And firm. What does it mean firm? In pathology, we have something called soft, like your lip, uh, firm, like your nose cartilage, hard, like your frontal bone. So on your face, just touch your lip, it's soft, soft touch. Touch your nose, it's firm and touch. Touch your frontal bone, it's hard. So the structure, the organ would be firm. But why? Why? Because here inside the necrotic cell, of course the cell will die. Will die of why? So we don't have cellular details. The cell will die. The cell, we cannot see normal cell. The cellular details will disappear. Why? Because the cell membrane will be destroyed, the nucleus will be destroyed, the mitochondria, the organs. But the outer frame of the organ, which called stroma, will be the same. Will be the same. But why? Because stroma can resist hypoxia for longer time. For example, when you take the kidney and put it under the microscope, you will see that the cells are destroyed, but the outer frame, it's normal. Why? Because the stroma, the fibrous tissue, and the stroma surrounding the cell can resist hypoxia for longer time. So it's important MCQ. In early stage of coagulative necrosis, the cellular details, of course, they are destroyed. The cells are destroyed because there's no cell membrane, there's no nucleus, there's no mitochondria. But architecture, architecture, it means that the outer structure in early stage is preserved. It means can resist hypoxia. But after that, later, of course, the architecture also will be destroyed. But in early stage, the stroma and the outer surface can resist. So we see that the cells inside are destroyed, but the fibrous tissue outside the stroma, the architecture, the surrounding stroma is the same. It's preserved. But in later stage, the cells are destroyed and the stroma also are destroyed. Examples, of course, renal infarction and myocardial infarction. Infarction mean when the blood vessel which supply the heart is blocked, then the cardiac cells start to die off, and it's called cardiac infarction. And in kidney also the same, renal infarction. Here it's pale in color, but after some time the necrotic cells will turn into yellow color. Anyone knows why necrotic cells in early stage it's pale in color, but in late stage it will be yellow in color? Necrotic cells in coagulative necrosis means that there is no blood supply, enough blood supply is going to the organ start to get pale color, then start to die off, cell membrane will die off, the mitochondria, the organ, the nucleus. In late stage, the color of necrotic cells will convert from pale into yellow color. Why? Anyone knows? I'll open the mic.
So maybe because of pus formation.
No, thank you, Siri. What the composition will be destroyed, guys, in necrosis? What are the composition which will destroyed? What are the main three organelles or structure or composition will be destroyed in necrosis, in irreversible cell injury?
Sir, maybe cell membrane, nucleus, and mitochondria.
Yeah, so cell membrane will be destroyed. When cell membrane is destroyed, we know that cell membrane is formed of phospholipid bilayer. Phospholipid, phospholipid bilayer. So the lipid, we know that the lipid has yellow color. So after necrosis in early stage, the the cells will be in pale, but after some time, when the lipid of the cell membrane start to dissociate and destruct it and deposit, so it will give the tissue yellow color. So in coagulative necrosis, in first, in early stage, it will be pale, but after some time, it will convert into yellow color because of destruction of lipids of the cell membrane. Okay, so coagulative necrosis. Three things we have to know: cause, the shape, and example. Cause, ischemia, which lead to hypoxia. The shape, in early stage, it's pale in color, but after some time, it will be converted into yellow color because of destruction of cell membrane and deposition of the lipid of cell membrane inside of necrosis, which will give the necrotic cell the yellow color. Cellular details will, of course, will be disappear because there's destruction of cell membrane and the nucleus, so there is no details of the cell. But architecture, the stroma, which surround the organ, will be preserved in early stage because stroma can resist hypoxia. But after some time, of course, due to inflammation, because we know that in necrosis there is inflammation. Inflammation will happen and immune cells will start to cause lysis of the stroma. But in early stage, stroma is intact. But after that, in late stage, the stroma will be damaged. Okay, an example, myocardial infarction and renal infarction. So myocardial infarction, you will take in cardiology, myocardial infarction in early stage, it's pale in color, but in late stage, it's yellow in color. Second, second type of necrosis, it's caseation necrosis. Do you know caseation cheese? الكازيني cheese. The casein cheese, it's like that. This is casein cheese. It's white yellowish. So here, the necrosis, it's not pale or yellow. It's white, yellow, white. It's like it's between the yellow color and white color. Caseation occurs due to tuberculosis, and we will discuss tuberculosis in details in tuberculosis chapter. But let me explain how tuberculosis can lead to destruction of the cells. For example, this is the lung. Bacteria, the bacteria which cause tuberculosis will go inside the lung. So the bacteria will come here. And after that, we have macrophage, which will engulf the bacteria. We have macrophage inside the lung. But unfortunately, the bacteria is very, very strong. So macrophage cannot destroy the tuberculosis. So macrophage will call the police, will call their friends, neutrophils, and a lot of macrophage, and start all these cells start to produce inflammatory mediators trying to kill this bacteria. And after that will come the strongest immune cell, T lymphocytes. T lymphocytes will surround the whole this inflammation and start to produce something called cytotoxin. Cyto means cells, toxin means toxin, trying to kill all all this tissue, trying to kill all this tissue, leading to death of all this part of the tissue, and this will convert into yellowish, white color. It's called caseation. Why? Because when tuberculosis bacteria get inside, the macrophage will try to engulf the bacteria, but the bacteria is very strong. Then we'll call another immune cells, T lymphocyte will come and will surround all of these inflammatory part, and will say no one will go outside. I will produce cytotoxin to kill all of this part. So after that, this part of inflammation will die off, and it will be in white, yellowish in color. It's called caseation necrosis. It's always occurred due to tuberculosis. Yellowish color due to cytotoxins of T lymphocytes. And of course, this part will be granular. What does mean granular? Granular means when this part, these cells are destroyed, some metabolites, some remnant of the cells will deposits in this part, and this part we call it granuloma. Granuloma means a lot of cells accumulated together with granules. Granules means remnant of dead cells with a lot of immune cells are surrounded together. It's called granuloma. And we have complete chapter talking about granuloma. So granuloma of tuberculosis, it's yellow, white in color, and granularly. And of course, here it's homogeneous. What does mean homogeneous? It means that this part will lose its normal structure. It's structureless because of course it's not normal structure. So it's homogeneous, yellowish in color. So caseation necrosis, we have to know three things: cause, shape, and example. Cause, tuberculosis infection. Shape, yellowish white in color. It's homogeneous, it's granular. Example, tuberculosis of lung, tuberculosis of intestine. And of course, we will talk about tuberculosis in details. It's called granuloma of tuberculosis. The third type of necrosis, it's called liquefactive necrosis. Liquid, what does mean liquid? Liquid means liquid, water, pus. So what's the cause of liquefactive necrosis? Liquefactive necrosis, it appears due to infection. When infection occurs in the cell, of course, the immune cells will come quickly to eliminate this infection and try to kill the infected cells. And the immune cell will produce proteolytic enzymes. Proteo means protein, lytic means lysis, breaking down. So it will break down the proteins of these cells, and this protein will be accumulated in dead cells, and then will convert into something called pus, like that. Pus. Pus, it's yellow liquid due to immune cells will destroy the protein here, will destroy the protein here, and the protein, destroyed protein will be accumulated with water, and here the protein will be accumulated for a long time, then it will be lysis due to proteolytic enzymes of the immune cell and converted into jelly or jelly like water. It's yellow dirty water. It's called abscess. So abscess means cyst filled with dirty white yellowish fluid. Why this fluid? Because when infection occurs, the immune cells will come and produce proteolytic enzyme. Proteolytic enzyme will destroy the protein of this part of cells, and the protein will be destroyed and converted into jelly-like fluid, yellowish fluid. Yellowish fluid surrounded with fibroblasts, because fibroblasts always come after inflammation, trying to surround this inflammation. So some pus surrounded by fibers, it's called abscess. It's called abscess. So the first example of liquefactive necrosis, it's proteolytic enzymes in abscess. Second example is brain infarction, death of brain tissue. Oh why? Oh shit! Why can we get abscess inside the brain cells? Why we can get fluid or liquid inside the brain? Because when when the cells inside your brain die off, we have something called myelin sheath. Myelin sheath, and this myelin contains a lot of lipids, and this lipid will be destroyed and then converted into fluid, So you can get fluid fluid and pus inside the cells, because when cells die, the myelin sheath will also die off, and the myelin sheath will convert it into liquid. It's called brain infarction. So brain infarction is it's example of liquefactive necrosis. Liquid because of myelin sheath degeneration. Myelin, when destroyed, will convert into pus. Liquefactive enzymes of amoeba. Amoeba, it's parasitic infection, and we will talk about the amoeba. We will say that amoeba also produce proteolytic enzymes, which can lead to destruction of proteins and convert the proteins into jelly-like fluid. It's called abscess. We call it amoebic abscess. When amoeba start to produce toxins and proteolytic enzyme, destroy the protein of the cells, and the proteins of the cell will convert into pus, surrounding by fibers, and forming amoebic abscess. And it's very dangerous. So the gross, of course, liquefied and yellowish liquid, and because it's pus, so it's yellow in color. And of course, it's structureless, homogeneous. Why? Because the tissue converted into another form, converted into pus, liquid. So it's complete, structureless, homogeneous. And cystic change. Why cystic means fiber. So here there's a fluid surrounded by fiber. Why fiber? Because of fibroblast cells, fibroblast cells, and immune cells, because immune cells want to surround this inflammation and this pus to prevent the spread of the pus. Because when we get pus, the immune cells will come and start to surround this pus, trying to prevent the spread of this pus. And also fibroblasts will come and start to form a lot of fiber around the pus, trying to prevent the spread of this pus. So here, there is liquid, yellow liquid, of course it's structureless, and cyst. Cyst means fiber around the pus due to fibroblast and immune cells. And we will find also some new capillaries. Why we can find new capillaries around this inflammatory part? Because your body is trying to solve the problem. Your body say, oh, we have some inflammation here. Okay, I'm gonna make new blood capillaries to send a lot of immune cells to try to solve this problem. So in this part, in liquefactive inflammation, we will see, of course, liquid. It's yellow in color. Of course, it's structureless because there's complete liquefaction. Of course, there is cyst due to fibroblast and immune cells. And also we will find new capillaries, new capillaries. Why? Because your blood is trying to solve the problem. And we will study this in details in inflammation chapter. Why your body make new blood vessels near to inflammatory site, because your body is smart. Your body is trying to solve the problem. And of course, in case of brain function, we don't have fibroblasts. We have glial cells. Glial cells instead of fibroblasts inside your brain. The last type of necrosis, it's called fat necrosis. And fat necrosis is it can happen due to two causes: trauma, and it's called traumatic fat necrosis, and enzymatic fat necrosis. So fat necrosis, it's a necrosis, of course, necrosis in fat cells, in adipose tissue, necrosis of fat cells. But why we can get necrosis in fat cells? First of all, trauma. Some women is passing the street and some car hit her. And of course, the woman is discharged to the hospital. And in the hospital, they didn't give any interest to her breast, because of course it's an accident. So it maybe it get a lot of fractures in different parts of her body. So they didn't give any interest to her breast. After 2 or 3 months, the woman start to find some hard, hard calcified lobule in her breast. And she will think, oh my God, it's breast cancer. It's breast cancer, but it's not breast cancer. So what is this? It's traumatic fat necrosis. Why? During the accident, the trauma of subcutaneous or fat tissue lead to rupture of fat cells. So the fat cells inside the breast is ruptured. And we said last time that calcium can bind with fatty acids and make some process called saponification. Saponification means formation of hard yellow deposits. When your calcium bind with fatty acids from ruptured fat cells, will form yellow hard deposits. So when the woman palpate, she will think that it's, oh my God, it's breast cancer, but it's not breast cancer. It's not breast, because when we take biopsy, we will see fatty acid and calcium. So we will ensure here, don't worry, there's some rupture happening in your fat cells, and the fatty acid release from the fat cells, and they emit some calcium, and calcium bind with this fatty acid and form something called sabun. Sabun, it's a hard white substance. This process is called saponification. So it's a very important MCQ in USMLE, that traumatic fat necrosis, it's misdiagnosed with breast cancer. Please write down that traumatic fat necrosis always misdiagnosed with breast cancer. The woman always think that she has breast cancer, but she doesn't. It's just saponification of some part of ruptured fat cells. The second type is enzymatic fat necrosis. What does mean enzymatic fat necrosis? Some patient went to the hospital to make surgery, and the surgeon opened the abdomen, and by mistake, the surgeon unfortunately cut and make injury to very important and dangerous organ, pancreas. So the surgeon by mistake injured the pancreas. And of course, we know that pancreas contains a lot of digestive enzymes like lipase. So when pancreas is injured, the lipase enzyme inside the pancreas will release inside the abdominal cavity. And lipase will start to destroy and digest the fat in your abdomen. Will start to destroy the fat in your abdomen. So what the problem? The problem that you have a lot of calcium inside your abdomen, in abdominal vessel or in intestine, you have a lot of fat, a lot of calcium. So calcium will go and bind with this destroyed and digested fatty acid and start to form sabun inside your abdomen. Holy shit, you have saponification, you have white hard substance inside your abdomen, and of course it's lethal. The patient will die soon. So if you gonna be a surgeon, you have to be very careful when you make any surgery inside the abdomen to not injure the pancreas, because if you injure the pancreas, the lipase will release, and lipase start to destroy and digest the abdominal fat, and the calcium will bind with the fatty acid in your abdomen and form sabun. It's like hard white substance. It's called saponification of the abdominal cavity, and of course it's lethal. It's lethal. And so inside the abdomen you will find, we know that calcium, it's a basophilic, not eosinophilic. It's a basophilic means the color is blue, bluish color. So this the calcium, and this eosinophilic, it's fatty acids. The fatty acid, it's like protein. But when they bind together, they will form white substance. It's called saponification. So the calcium is blue, and the fatty acid is red. But when calcium bind with fatty acid, convert into white hard substance called sapon, saponification. I hope you understand. The last type is fibrinoid necrosis, but we don't consider it like necrosis. Why? Because to say that it's a necrosis, you have to get cell membrane damage, mitochondria damage, and nucleus damage. But in fibrinoid necrosis, why they why they put it in necrosis types? Because before a lot of years, they they found some deposition of some organs, and they thought that these deposition, it's a necrotic cells, but it's not necrotic cells. Why? Fibrinoid necrosis, it's caused by some group of diseases, autoimmune diseases, like for example in rheumatic fever, and we will discuss rheumatic fever in details in this systemic pathology. In rheumatic fever, some auto antibodies will go to your heart and start to destroy some proteins inside cardiac cells, and these proteins will attach together and form something called Ashoff nodules. Ashoff nodules. These nodules. So when they saw these nodules, they thought that this is a necrotic cell. This is a dead cell. But no, it's not dead cell, because the cardiac muscle is working. The cardiac muscle, the cardiac cell, they are not dead. They are not necrotic. Here you cannot find destroyed cell membrane or destroyed nucleus or destroyed mitochondria. It's just there are destruction in some proteins, and these proteins they are binding together and form nodules. It's called Ashoff nodules. But here there is no destruction of mitochondria, there is no destruction of cell membrane, there is no destruction of nucleus. So it's not necrosis. But they thought that these nodules, they were living cells before, but now when they get necrosis, they destructed, and the cell membrane got damaged, mitochondria damaged, nucleus damaged. But no, it's not damaged or necrotic cells. It's fibrin deposition. So it's called fibrinoid necrosis. Oid means fake. Fake. Why? Because they thought that this fibrin is a necrotic cell, but it's not necrotic cells. It's just deposition of some fibrin, and they are connected together and form something similar or look like necrotic cells, but they are not necrotic cells, because you can find in the cardiac cell, it's red in color, it's a fresh cells, and cell membrane is found, is present, the nucleus is present, and also mitochondria is present, but just some deposition of fibrin nodules. So we call it fibrinoid necrosis. Oid means fake. So today we talk about irreversible cell injury, and we talk about the necrosis. Necrosis, and we said necrosis is a death of group of cells, not just one cell. Why? Because when some cell die, the free radicals will go outside the cell and start to destroy the next and next cells, all neighboring cells. And we know that necrosis is always surrounded by inflammation due to response of immune cells. Immune cells try to surround the necrosis, and fibroblasts try to surround the necrotic site. And we talk four types of necrosis. First one is coagulative necrosis. Second, caseation. Third, liquefactive. Fourth, flat necrosis. And the fifth one, we don't consider like necrosis. It's called fibrinoid, fake necrosis. And in each type, we have to know three things: cause, the shape, and example. Coagulative necrosis, please replay with me. Coagulative necrosis, the cause is ischemia, which lead to hypoxia. The shape, pale, but in early stage. After some time, it will convert to yellow. Why? Due to destruction of lipids inside the cell membrane. Example, myocardial infarction and renal infarction. And also we say that in early stage, the cellular details will be destroyed, but the stroma, the outer outlines will be the same, but in late stage, the outer outlines will also destroy it because stroma can resist hypoxia for some time. Second one is caseation necrosis. The cause is tuberculosis. The shape is like casein cheese. It's yellow white color, soft, granular, homogeneous. And example, granuloma of tuberculosis inside the lung or intestine. Third one is liquefactive necrosis. Liquefactive necrosis, it's caused due to proteolytic enzymes in some abscess, brain infarction due to myelin destruction, and liquefactive enzymes of amoeba, which form amoebic abscess. And we said that due to proteolytic enzymes from the immune cells or from the amoeba cause destruction of proteins, and this protein will accumulate together and convert it into jelly substance. It's called pus. And of course, pus is yellowish and liquefied. And also, we said the microscopic features is there is here is white yellowish color surrounded by fibers due to immune cells and fibroblasts, and new blood capillaries. Why? Because your body is trying to solve the problem. Your body is trying to get rid of this pus. And last one is fat necrosis. And we say fat necrosis can cause types of fat necrosis is traumatic fat necrosis and enzymatic fat necrosis. Traumatic due to trauma, when trauma lead to rupture of fat cells, and then the fat cells, fatty acid will be released, binding with calcium and lead to saponification. And we said that traumatic fat necrosis in breast always misdiagnosed with breast cancer. When the woman palpate the breast and see hard, hard mass, she thinks that it's breast cancer. But when we take biopsy, we will find that we will find calcium is binding with fatty acid, and we will ensure here, don't worry, madam, it's not breast cancer, it's saponification of the breast. The second type is enzymatic fat necrosis due to pancreatic injury. When the pancreas is injured, the lipase will be released, and lipase will digest and destroy the fat cells in omentum abdominal cavity. And inside the abdomen, the calcium will bind with fatty acid, of course, and lead to saponification. Saponification means forming of white hard substance inside your abdomen, which is lethal. It's fatal. And the last one is fibrinoid necrosis. Fibrinoid because it's a fake necrosis. They thought that this fibrin is a necrotic cells, but it's not necrotic cells. Some autoimmune diseases like polyarthritis nodosa or inside or during rheumatic fever, some auto antibodies. These antibodies go to the cells and destroy the fiber inside the cell, and fiber will be deposits inside the cell. And they thought that this it's not deposit fibrin, it's necrotic and dead cell, but it's not necrotic cells, it's fibrin deposits. And of course, this fibrin, it's a protein. Fibrin is a protein, so the color will be eosinophilic red. So fibrin deposits, it will be eosinophilic red in color. So we finish for today for today, guys. I hope you enjoyed and I hope you understand everything in the lecture. If anyone has any question, go ahead. I'll open the mic. If you have any question, so guys, everything is clear.